Hi, I'm Dr. Kelvin, and in this video I'm going to show you the absolute best exercise, a treatment technique for an inflamed sciatic nerve for herniated discs, without the need for surgery, with exercises you can do at home. And I'm not exaggerating, several scientific studies have already shown that this technique that I'm going to teach you in this video is one of the best for treating herniated discs. I'm talking about the McKenzie approach, or McKenzie exercises. These exercises aim to centralize the pain for people with an inflamed sciatic nerve. But what does it mean to centralize the pain? That pain from a herniated disc with an inflamed sciatic nerve often radiates down the back of the legs, the calf, and many times even to the little toe. And the centralization of pain, which is the goal of the McKenzie approach, is to make the pain concentrate in a single spot. In other words, for the pain to stop radiating and become centralized in the spine. So that, once the pain is centralized, using these same approaches, the person can then treat that pain, reducing those symptoms of a herniated disc and an inflamed sciatic nerve. Don't forget to leave your like, subscribe to the channel, and activate the notification bell so you can get more videos like this one from this channel. Pay attention to me here, because I'm going to explain this exercise step by step, so you can understand it better and follow along while watching this video. So, let's get started. Step number 1. If your sciatic pain is intense, lie face down on a bed, massage table, or mat, on top of 1 or 2 stacked pillows, and stay in this position for 5 minutes. Step number 2. If your pain isn't intense, you can skip the first step. Now you simply extend your torso, resting on your elbows. And at this point, it's expected that the pain radiating down your calves and below your knees, in the back, should already start to decrease. Step number 3. If your sciatic pain gets worse, you should stop this exercise immediately. But if the pain doesn't get worse, you can progress by placing your hands at shoulder level and straightening your elbows, doing the movement you're seeing in the video, but without lifting your legs or your hips or your pelvis off the floor. Do 5 to 10 repetitions daily. Starting from the first week, the exercise will start to get easier, and the symptoms of sciatic pain, numbness and tingling, may start to decrease in your legs. And as this exercise gets easier and easier, you can lift your torso, raise your torso even higher, remembering not to lift your pelvis off the floor, of course, and lifting your torso even more. You'll be able to progress with this exercise, with even more satisfying results. This video was inspired by the comments you're seeing on your screen. Don't forget to leave a comment. I read all of them, and there's a good chance I'll respond to your comment in a future video, just like these here that inspired the video you're watching. And what should you avoid doing when performing this exercise? Right now, I'm going to share with you some of the biggest mistakes that people make when doing this exercise, so you don't make the same mistake. What you shouldn't do is this here, as if you were doing a push-up. That doesn't work. On the contrary, you should form an arch with your back. So, in this exercise, your spine needs to curve. Your spine can't stay straight. It needs to have a curve to better mobilize your spine and the spinal cord that's running inside it. And that's what will relieve the pain from an inflamed sciatic nerve. But why is this exercise so good for a herniated disc? Let's see. Why is this exercise, this McKenzie approach, so good for people with a herniated disc? Our intervertebral disc in our spine is kind of like a bubblegum gum, like the one you're seeing here. It's hard on the outside and has that gooey stuff inside, just like you know. The disc is very similar to that. The disc, actually, is made up of 80% liquid. So there's a lot of water inside the disc. And what happens if we squeeze our disc from the front? If we put pressure on it? Well, I can't touch my disc with my fingers, but I can press on them through the movement of my vertebrae. For example, we have 23 discs in our spine, each one between the main vertebrae we have. So, if through the movement of trunk flexion, if I bend my trunk repeatedly, it's not just doing this once that's going to make everything worse. That's going to ruin my disc. But if I do this over and over again, look what happens if I squeeze my bubblegum gum here in the front. Its contents will come out the back. That's what happens when we have a herniated disc. Notice that pressure is applied to the front part of the disc. This hernia bulges out to the back, and it starts to compress a nerve. When this hernia compresses the nerve, this compression, it causes inflammation, and then all those symptoms of radiating pain appear, tingling down the legs. And this exercise I just taught you, it does exactly the opposite. Instead of pressing the disc at the front, it applies this pressure, but it's a healthy pressure, a gentle pressure at the back, trying to get that herniated disc to move forward now, to move toward the center of the disc, so that it stays in its original place. And that's why a herniated disc, it can be treated. and most of the time it is treated very successfully, without surgery. As this study shows, the herniated disc returns to its original place, without surgery, just with proper exercises, and a herniated disc is a case where the vast majority of surgeries performed could be avoided, and many of these surgeries end up leading to an even worse problem. A problem that might never have happened if the person had simply done the exercises instead of having surgery. But since this video does not replace a medical consultation, I recommend that you look for a specialist you trust if the first one you saw wants to perform surgery on you. Seek other opinions from more conservative professionals. Another thing, remember I told you that the disc inside our spine, 80% of the entire content of that disc is liquid? So what do you need to do to avoid that dehydrated disc, that dried out disc, that disc in the process of herniating? You also need, considering this information, that the disc is 80% liquid, to drink plenty of water, 500 milliliters of water a day, 1 liter a day. Then there's no point complaining that your disc is dried out, that your disc has a hernia, that you have lower back pain. You need to drink plenty of water, at least 2 liters. If you can do 3, even better. And besides this exercise from the video, do physical activity, because when you do these physical activities, prescribed by a professional, by a physical therapist, you increase blood circulation. And even though the disc isn't vascularized, there's no blood flowing inside the disc. Some veins and arteries do run around the disc, and the fluid that's flowing inside those blood vessels around the disc, some of it ends up being transferred to the disc as well. And if you drink water and do physical activity, increasing your blood circulation, including around the disc, that's great for keeping your disc more hydrated. Finally, one of the main causes of a herniated disc is weakness in the abdominal muscles and weakness in the muscles surrounding our spine. So, strengthening your back is a great option, both to prevent a herniated disc and to treat an existing herniated disc. With that in mind, I've prepared 2 more videos for you. One about how to strengthen your back, and another with mobility exercises for the sciatic nerve to help improve a herniated disc. Be sure to click on one of these videos, because they'll be really helpful for you, and I'll see you there.